Scientists are warning that an antibiotic-resistant strain of gonorrhea is on the rise. The journal New Scientist says 34 such cases have been detected in England since 2014. And it's a worry because sexually transmitted infections like this can cause infertility in women who may have no symptoms. For more, I'm joined by Professor David Lewis from the University of Sydney, and he's also the director of the Western Sydney Sexual Health Centre. Can you tell us firstly, authorities in the UK are really concerned about what they're calling super gonorrhea. Are we seeing the same thing happening in Australia?
Well, thank you very much for inviting me to talk about this very important issue, Nicole. We have seen the same thing in Australia, but much smaller numbers. There were 34 cases reported in the UK, and we had 2 cases in New South Wales in 2014 and a further 2 cases in 2015, one in New South Wales and the other one in urban Western Australia.
So are those numbers significant?
They're still very small numbers. I think the important thing about gonorrhea is it's very easy to transmit and it spreads very easily through unprotected sex. So we are worried. I would be particularly worried the fact we've now got 2 parts of Australia where we're picking up this organism. So it does bode a little bit of concern, I think, for the future and whether this will spread more within the country.
In the UK, doctors are being urged to double-check patients that they've treated to make sure that they are in fact cured. Do we know what's actually driving the spread of this disease, particularly the antibiotic-resistant strain?
We know quite a lot, and it's a lot of factors, but key and very important, of course, is unprotected sex and having rapid partner exchange. So that particularly involves young people who may be making lots of new partnerships early on in their lives. Also, we know there's a lot of gonorrhea resistance issues amongst men who have sex with men, particularly those who have multiple partners. And the key other important area is lack of use of condoms. So condoms are very important for protecting you against not just HIV, but STIs also. And there's been a move, across the world now for HIV prevention to move towards more what we call biomedical technologies, such as taking HIV drugs if you're HIV negative to prevent HIV, and that works really well for HIV, but of course not using a condom leaves you open to STIs.
And I understand in the Australian context, Indigenous Australians are particularly at risk.
Yes, and it's a real big concern, particularly in the rural, very rural populations. The data from 2015 from the Kirby Institute showed that Aboriginal people are about 18 times higher
18 times
higher rates compared to non-Indigenous populations.
So does that mean we need more safe sex messaging aimed particularly at these Indigenous communities?
I think that's important. I think it's important for the whole population, but also I think it's an issue about access to services as well. It's not easy in rural settings necessarily to access good health care. Doing diagnostic testing is a real challenge if there's not a laboratory nearby. So there are a number of health matters that need to be looked at.
We'll leave it there. Professor David Lewis, thanks for coming in today.
Thank you very much.